6 strategies to combat AMR. As recently as just 90 years ago, people could die of simple bacterial infections because there was no medicine available to treat them with. The discovery of penicillin changed all that and meant that literally millions of people could be saved from these previously lethal infectious diseases. In the years that followed, the discovery of new antibiotics led some to think that infectious diseases would be consigned to the history books. As a result, antibiotics began to be used very widely, without adequate controls. Unfortunately, we now know that bacteria can evolve to develop resistance to any new antibiotic. And unfortunately, the rate at which this resistance develops is faster than the rate at which new antibiotics are discovered. Globally, it's estimated that approximately 700,000 people die every year because of antimicrobial resistance, or AMR. To put it another way, this amounts to 1 death every single minute. In Thailand, it's thought that AMR is responsible for more than 30,000 deaths per year, with an associated cost of more than $1,200 million. It is also expected that if nothing is done, the burden of antimicrobial resistance will rise over the next 30 years to reach 10 million. At this rate, every minute, 19 people would die. It is also predicted that almost half of this death toll would be in Asia. The economic burden would then amount to $100 trillion. Antimicrobial resistance occurs everywhere where antibiotics are used indiscriminately. It can also be spread in hospitals, clinics, pharmacies, communities, livestock farms, in aquaculture, in agricultures, and in companion animals. In addition, it can spread to and so contaminate the environment. And due to the huge rise in travel, trade, and the transportation of goods, AMR can spread easily and rapidly. In this way, it has become a truly global crisis. So, the best ways to tackle AMR problems are: 1. Stop the inappropriate use of antibiotics in humans, animals, and plants. 2. Prevent and control the spread of AMR in humans, animals, and environment. In the past, although different sectors in Thailand tackled AMR through a variety of measures, the trend of antimicrobial resistance has continued to increase. There are several reasons for this, but the 2 most important factors were the absence of a national strategic plan and a lack of coordination between concerned sectors. In 2015, the Ministry of Public Health, together with relevant agencies, established a committee to develop a strategic plan on AMR. The plan underwent a public policy hearing in the National Health Assembly and was then endorsed by the Cabinet as Thailand's first National Strategic Plan on AMR. This was and remains a starting point for everyone to work together to address AMR in an integrated manner under the One Health approach. The National Strategic Plan on AMR consists of 6 strategies. Strategy 1. Conducting AMR surveillance under the One Health approach in order to detect and prevent the spread of AMR in humans, animals, and the environment, and to alert and respond to the situation in a timely manner. Strategy 2. Controlling antimicrobial distribution by using both legal and social measures in order to properly regulate the sale of antimicrobials for use in both human and animals. Strategy 3. Prevention and control of hospital-associated infection, as well as ensuring antimicrobial stewardship by focusing on collaboration among health professionals and appropriate use of antimicrobials in healthcare settings and pharmacies. Strategy 4. Prevention and control of antimicrobial resistant pathogens and ensuring antimicrobial stewardship in the agriculture and aquaculture sectors, as well as in companion animals. Strategy 5. Educating the public about AMR and increasing public awareness on the appropriate use of antimicrobials. This means passing along key messages to different groups of people about the threats caused by AMR, as well as discouraging them from self-medication with antibiotics. Strategy 6. Strengthening governance mechanisms at policy level to address AMR issues effectively and sustainably. If these 6 strategies are implemented successfully, we believe that the rate of AMR morbidity should reduce by 50%, and antimicrobial consumption should decrease by 20% in humans and by 30% in animals. We also expect to see public knowledge increase by 20%, and that Thailand's AMR management system will meet universally accepted standards. Antimicrobial resistance is a serious threat to mankind because it affects all species and respects no borders. So let's implement these 6 strategies and join hands with global community so that we can all tackle this serious crisis on AMR together.